All right, thanks for joining us. I'm Ernest Lunning with Colorado Politics, here today with Attorney General Phil Weiser, one of the Democrats running to be Colorado's next governor. He's going to be answering questions prepared by AARP Colorado. We'll be asking the same questions to the other candidates who are running for the chance to take over from term-limited Governor Jared Polis. General Weiser, please take a minute to introduce yourself and tell us why you're running.
Ernest, my commitment to service starts with my family story. I'm only here because the U.S. Army liberated my mom and my grandmother from the Buchenwald concentration camp in April 1945. They chose to come to America because they believe this is the land of freedom and opportunity for all. And my life has been devoted to public service because I believe in that ideal for everybody. And I'm so grateful that in my family, from one generation, we went from being liberated in a concentration camp to me becoming a lawyer, working as a law clerk for Justice Ruth Bader Ginsburg, working as advisor to President Obama in the White House, as Colorado's Attorney General, and our next governor. My commitment serving here in the state is to always fight for people and to make sure that people know I've got one true north, which is making your life better and taking on anyone who's trying to harm you or take advantage of you.
New data shows that there are more than 1 million family caregivers in Colorado. What kind of policies or legislation would you champion to ease caregiver burdens?
Ernest, caregivers in Colorado, they're concerned about what we all are concerned about, starting with the environment we're living in under this lawless, bullying Trump administration. For people who are caregivers and have family members or friends who are from the immigrant community or the LGBTQ plus community, they're worried about an administration whose intimidation efforts is to provoke fear, to harm people, to pick on marginalized groups. I've stood up as our Attorney General, went to court 45 times against this administration. I'm mostly winning protecting Colorado, protecting funding key programs, protecting our rights. We need a fighter who will stand up against this administration. Michael Bennet, my opponent in this race, he's voted for more of Trump's cabinet than almost any Democrat in the Senate. This is a moment for fighters, not those who try to accommodate. And caregivers, they're worried about the affordability crisis that we're facing. Can they afford a place to live? Childcare, healthcare. As Attorney General, I fight for the people of Colorado. I fight to make life more affordable, taking on irresponsible companies like those who jack up these junk fees, making it more expensive to live places, or try to collude, like a number of corporate landlords are doing, using algorithms. I'm going to always make sure I'm fighting for the people of Colorado to improve their lives, and caregivers need a governor who's going to do that.
Thank you. Older Coloradans are not immune to the housing affordability crisis. What policy solutions will you seek to help Coloradans age 50 and older keep affordable housing?
Colorado has a huge housing challenge. We're one of the more expensive places in the nation to live. It's going to take a number of policies. I've put out a comprehensive approach to both housing policy and other policies on my website. We call it the Colorado Blueprint, over 100 pages. Please check it out at philforcolorado.com. What I talk about are a few things. For renters, as I just mentioned, I'm going to make sure that these corporate landlords don't get away with deceptive junk fees. They can advertise, for example, $1,500 or $2,000 a month and then add all these additional fees on, take advantage of people. Or the collusion I mentioned. In Denver, that's costing renters more than $130 a month. We're going to make sure we put a stop to it. With those who want to buy homes and want to be able to afford to buy homes, we need more homes in the market, particularly in that middle segment, often called attainable homes. We're not building enough of them because if you're trying to build an attainable home, it's the same time to get a permit. It's the same cost as to build a luxury home. I've got a whole plan for how we build more housing. And my plan covers rural Colorado too, because too often our policies work in Denver, but not in our rural communities.
As the number of Coloradans over age 50 increases, what can be done to help them age in place and remain in their communities?
Colorado needs to make sure that we have the infrastructure to support people to live in an engaged community. One of my concerns is too many people are disconnected. We have a loneliness epidemic, and that can affect older Coloradans particularly. We need to make sure that we are building the healthcare, the other care infrastructure, so that older Coloradans can live where they're comfortable in their communities. We've got a number of ideas of how we can do that. I also want to make sure that we're keeping our communities safe for older Coloradans so they can continue living safely. And right now, in communities like Denver, we don't have enough law enforcement officers. So people are at risk of, if they get preyed on, if they're a victim of a crime, a law enforcement officer may not even show up, a reason why some people are leaving their communities. And we've got to make sure that we're keeping young people here so we have enough people who can take care of older Coloradans. This is a crucial moment for our community. I'm going to bring seasoned leadership. I'm not coming to state government new. I've been Attorney General now for 7 years. I've done work on the opioid crisis showing I know how to get meaningful results. Not only did I bring in $900 million to address an opioid crisis, but we delivered results, the best framework, according to Johns Hopkins School of Public Health, John Oliver, and more.
Along those lines, what do you see as the biggest public health challenge facing the state, and how will you address it?
There's so much here, Ernest. I'm going to try to keep it tight.
It's a big question.
First, we got to make sure our healthcare system is working for patients first. The incentives need to be a health system, not a sick system. We need patients to get care upfront, affordably, and so they don't get more sick. And unfortunately, the incentives are often the opposite of that. Second, we got to make sure we're taking behavioral health seriously. I mentioned just now the opioid crisis. I got to work on this crisis because addiction has undermined so many communities and has put so much pressure on our criminal justice system. My leadership on the opioid crisis, and you can read about it at philforcolorado.com, is part of what I bring to this job. Also, another huge public health challenge is mental health for people of all ages, including older Coloradans to younger Coloradans. Take young people, for example, 19 to 29, 40% of them say they're lonely. I've got a plan to address youth mental health, to make sure we build mentors for everybody. And 40% of kids growing up say have no mentors. To make sure that people aren't lonely, to make sure that we're connected, because when you are not lonely, you're actually healthier.
Well, thanks. From a legislative perspective, as governor, what can be done to improve our state as a great place for fitness, health, and well-being for Coloradans of all ages?
I talk a lot about this, Ernest. We need to make sure that all of us get off our phones, get outside, and we continue to live up to a title that I'm so proud of, the healthiest state in the nation. What makes people healthy? If they're outside more, if they're exercising, if they're eating better and have access to healthy food. We need to take this really seriously, because by being healthier, physically healthier and mentally healthier, people live better lives. And the youth mental health crisis I mentioned earlier, people being on their phones, it's especially a bad problem for young people. Although it can affect people of all ages, young people are spending 6 hours a day on their phones, including an hour during the school day, getting notifications and alerts at all times of day, going down dark holes. I'm suing Meta, investigating TikTok. I pursued a policy that we passed into law. Every school district has to make sure they've got a policy to prevent smartphones from interfering with learning. We need to make sure that young people, people of all ages, are getting outside, building relationships, exercising, and not just on their phones.
The state legislature is tackling major consumer safety issues as technology rapidly evolves and changes, such as putting guardrails on businesses and governments, use of AI to make decisions that impact people. What is your philosophy on balancing consumer rights and technological innovation?
One of the major advantages that I bring to this race is all the experience I have working on legislation with the legislature. Michael Bennet brings 17 years of Senate experience, which is why there's a bumper sticker out there that says, Phil Weiser for governor, Michael Bennet for Senate, because he's got all that seniority expertise there. I've got the seniority and expertise here in Colorado, knowing how to get to work on day one. This is a great example. I worked on a Colorado Privacy Act that I was able to lead, and we listened hard so that the point you made, what works for a business and what works for consumers, it doesn't have to be in conflict. Smart public policy, responsible public policy doesn't put burdens on businesses that don't make sense in the name of trying to protect consumers in a way that may not work. Unfortunately, you mentioned the AI law that has real problems with it because it puts burdens on businesses that don't make sense and don't actually do the intended purpose of helping consumers. And the way to hit that balance is to make sure wherever possible you get out front. And when someone says, I'm concerned about this issue for consumers, whether it's data privacy, artificial intelligence, or something else, we ask the important questions. Have we thought about unintended consequences? Are we sure we're getting this right? And I'm proud of the way we did that work in data privacy. We can do better than we've done in AI.
Groups like the AARP consistently hear from members that rising utility costs pose affordability challenges for Coloradans on a fixed income. Additionally, inadequate heating and cooling can cause significant health risks for older Coloradans. As governor, how would you balance competing interests, clean energy targets, data centers moving in, and ensure affordable utilities for older Coloradans?
Ernest, I hear from AARP members a lot because we've got a partnership with AARP in the Attorney General's office. We call it Elder Watch. The focus of that partnership is around how do we make sure that older Coloradans aren't getting scammed or subject to fraud, because there's so many pressures out there that makes it harder to afford living in Colorado. One of the pressures you note is, what are you paying in energy for electricity? And there's a bunch of points there I want to pick up. One, the most affordable, the smartest, and the cleanest energy are the energies of the future. Energies like solar, like wind, like batteries, like geothermal, which is really promising. We need to make sure that we're moving ahead effectively, building those sources of energy, getting them to consumers, and consumers can use those energies effectively. We also have to make sure, the point you note about data centers, that they're not taking advantage of consumers, and that if data centers come to Colorado, they're bringing, if you will, the energy, and they're bringing online the energy so it's not in the backs of consumers. We're going to be smart about how we manage our energy, not to let consumers end up getting taken for an unfair ride. I want people to know, as Attorney General, I've been a fighter for consumers. I am an enforcer. I don't tolerate big businesses taking advantage of consumers. I'm going to bring that same mindset to the governor's work.
Here's our last question is, Colorado has established a first of its kind Prescription Drug Affordability Review Board to research and review the cost of prescription medications to consumers and even set upper payment limits on certain medications. Do you support PDAB, and how do you plan on further ensuring medication affordability for Coloradans?
This question is a big difference between myself and Michael Bennet. As Senator Michael Bennet voted against any drug abortation opportunities, he voted against allowing generic drugs to have an easier way to enter against brand names. Brand names often buy off generics in what are called pay-for-delay deals. I fought against those as an antitrust enforcer. Michael Bennet hasn't fought against them. I hear from older Coloradans how much they're hurting. That's why I've made this work a priority. I've taken on Big Pharma, not just in the opioid crisis, where I brought back 900 millions, but for price fixing among generic drugs. I worked in the legislature to get a cap on insulin, on EpiPens, to make sure that people have affordable access. And I'm defending this law that you're talking about now around affordable drugs. When you look at our healthcare system, we can see it's not working for people. It's charging people too much, and we've got to do better. One of the ways we do better is making sure we've got more affordable access to important drugs. I've done that work. I'm committed to doing that work.
Okay, well, thank you. And thank you. Please check out our interviews with the other candidates for governor and candidates running in the 8th Congressional District on coloradopolitics.com and at AARP Colorado. Thanks for watching.